When walking on 3 legs is hard enough, having this leg do that to her is an even bigger issue for her.
On this week's Bondi Vet compilation.
I do think in this instance that it is probably the best option to consider amputating the tail.
It's not looking very nice for him, so we've got to have some quite serious conversations with the owner about where we go from here, really.
Hey, baby. There you go. Is that comfy?
At the Bondi Clinic, Rose has brought in 11-week-old Annika, desperate for Chris's help for the little girl's deformed leg.
You're going to be very brave.
The poor Akita puppy has had a rough start to life and was recently surrendered to the Animal Welfare League.
Oh, thank you. Oh, thank you. Oh, thank you.
When I first saw Annika, I saw that leg and was kind of a little bit overwhelmed. I really hope that it's not causing her any pain. That's the main thing that I'm concerned about, really her quality of life. And I'm really hoping that Dr. Chris can get to the bottom of it.
Hey there, how are
G'day,
you?
Chris. Rose.
Nice to meet you, Rose. This is Annika.
Yeah, this is Annika.
And what about you?
Yep.
Wow, look at that.
Yeah.
All right, let's see if I can help you.
Yeah, okay.
Come on in.
Thanks very much. Come on.
No matter how much it feels like you've seen animals with all sorts of different problems, there's still that moment when I first lay eyes on Annika where I think, wow, what is going on with that leg? Yeah, that's like nothing I've ever seen before.
Yeah, me too.
Do you know much about how she came to be this way?
She was apparently born like this,
Yep.
and the owners who bred her just brought her in and couldn't afford any treatment.
Well, as far as you know, there's no history of any deformities or any other problems.
We think that she was part of a litter and the rest of the litter died, and the mum was in labour for about 3 days.
Okay, so it's obviously a pretty tough start to life for any dog, and I mean she's clearly lucky to be here if all the rest of them didn't make it.
Yeah, definitely. She's pretty special.
This sort of situation is certainly a first for me. I've never really seen a case like it, and there's a lot of wondering just how I'm going to be able to help her. And I guess if there's one thing that's probably a little bit sobering is that obviously the leg is the most obvious issue that Annika has, but to be born into a litter where none of the other puppies have survived,
Yep.
the concern is she may actually have other issues there as well.
Oh, I really hope not.
Obviously with that twisted leg being such a dominant feature, the temptation is to rush in there and just look at that. But there's every chance that what we're looking at here is a genetic abnormality, a deformity. So if you have one issue, quite often you have a second one, and that is certainly a worry.
Good girl.
All right, well, let's have a look over you, miss. One of those areas where you often do see a lot of problems in dogs that genetically aren't quite right is in the cleft palate, so just in the roof of their mouth.
Yeah.
It's important in such a sad case like Annika to try to find some positives, and already we do have some because her eyes, her ears and her mouth are actually looking pretty good. All right, so let's just have a listen to her chest and just see what's happening internally. All right, so look, the heart actually sounds pretty good.
Oh, good. Great.
Yeah, I mean, the beats are quite clear. They're quite strong, and her lung sounds are also very clear.
It's a relief for carer Rose to hear that so far Annika is looking good. So Chris can now turn his attention to the front legs.
So I can feel her scapula, her shoulder blade there. Hello, thank you, it's very kind. Yeah, bit of encouragement, thank you. And we go down to a humerus there. All right, so we're feeling pretty good. Nice, free and easy.
Good.
Which is very important because at the moment this front left leg is doing a lot of work. It's really supporting that whole front half of her body.
Good. Yay.
All right, let's look at this leg.
Okay.
Starting at the top, there is a shoulder blade there. So that part feels like it's formed relatively normally. As I work my way down across her shoulder blade and then onto a humerus, everything's feeling pretty normal. But suddenly, once I reach Annika's elbow, things take a dramatic turn. We're really 90 degrees off where we need to be, which is a long way.
Yeah.
It feels like everything from the shoulder joint down isn't how it should be.
Okay.
One of the front leg's main jobs is to be able to reach forward and allow a step to take place. But in the case of this leg, the range of motion just isn't good enough. So with those toes pointing so far back, they're never going to support the weight in the position they're in.
Right.
And there's no clear definition of her individual toes.
Yeah, right.
So we know she's got feeling in the upper part of the leg because she doesn't like it when I push it forward.
Right.
But I'm very keen to see if she's got feeling in her toes.
Okay.
Because that'll tell us whether we have a nerve running all the way down to the bottom of this leg.
Oh, right.
I'm squeezing really hard there. There's nothing there, is there?
Yep, she's not responding.
Suddenly, we arrive at what might be the most dramatic finding yet. Annika has no feeling in that paw. If she can't feel in that leg, it really limits what we can do with it. And obviously, I'm, at the moment, just trying to think of every single possibility we can come to and arrive at to give her the best possible life, because that's what it's all about with her. She's a puppy. She should be tearing around playing. She should be having the time of her life. But for her, short little bursts are even too much.
Annika's a gorgeous puppy. Just the thought of her being in pain or being exhausted means her quality of life is compromised, and I can't watch a dog going through that. There's just nothing more heartbreaking, and I'm choking up just at the thought of it because it's really, really sad.
So, yeah, I mean, it's kind of, I guess, the living proof of why she does need something to be done.
Yeah, that's really heartbreaking. I just want her to be okay.
Yeah. What I'll do, could I get you to stand just here with her? And then I'm going to stand up this end. And hopefully when I call her, she'll come running towards me, because I want to see how those legs of hers move.
All right. You can do it.
Rose has brought Annika to me in the hope of me providing her with a good quality of life, a positive outlook. But I can't do that unless I know exactly how she's walking right now. Annika, come on, come here, come here, come here. Good effort. Watching dogs with 3 functional legs walk is always an amazing thing to see. But in Annika's case, she does something that's quite surprising. So, it's obviously not easy for her. Each of those steps is an effort, but she is still in the learning stage.
Yep.
Can we do it one more time?
Sure.
Because there's something that I noticed there that I want to look at more closely.
Come on, baby.
I keep on reminding myself of the fact that Annika's 7 kilos now. She could be 40 kilos one day.
Go to place.
Come here.
Go to place.
And the way she walks right now, I don't believe is sustainable. And if you look closely, at the same time that this leg goes forward, this leg here, in trying to do what it wants to do and actually walk, actually pulls back.
Right.
When it does that, it does something to the way she walks. It actually throws her off balance.
Poor thing, that must be hard.
Yeah. When walking on 3 legs is hard enough, having this leg do that to her is an even bigger issue for her.
It's going to be impossible.
It's going to make it really hard. The best thing now is to take an x-ray.
Okay.
Now, an x-ray is going to tell us exactly what's happening structurally with this leg.
Righto.
We now know more about what's happening functionally, but once we know what's happening internally with the bones, then we then have all the information we need to make a judgment call on what we can do for that leg.
Okay.
Every single step here is revealing more and more about how Annika lives her life. But if she's going to live a happy life long term, we need a solution. And that solution ultimately revolves around what's happening on the inside of this leg. So are you okay if I take her through for an x-ray now?
Yeah, for sure.
And then I'll let you know exactly what we find.
Yeah, baby, be brave. You be brave. Best girl.
All right, thank you.
Thank you.
I'll see you soon.
Bye. See you, honey.
It's okay. It's okay. There we go. Yep.
X-ray.
Can't say I've ever seen an x-ray like this before. This forearm here, which is, you know, the equivalent of this on me, that should be about twice the length. And it's just not really going to its full distance. And these toes here, it's just essentially a little bag of bones. And looking at this x-ray really confirms that what we're looking at here is a deformity. There are a lot of different ways to interpret this result here. For me, it is a good thing. What we're seeing here is confirmation of what we've been essentially proving over the last few hours. So to me now, it's clear how we provide Annika with a bright future, how we can actually give her the rest of her life pain-free and full of happiness. There is only one answer. Hey, Rose. All right. So, to me, the easiest way to open up her future is quite simply to get rid of that leg.
Okay. Fair enough. Yeah. Yeah, I guess if that's what you think is going to be the right thing, that's all I want.
Yeah. There's no way of saving the leg. I think that's the thing to remember here. There's no way of putting sensation into a leg that has none.
Yeah.
There's no way of rebuilding a leg when the bones actually aren't there in the first place.
Fair enough.
And so that's where the challenge is. And the positive outlook here is the fact that she'll do brilliantly without this leg holding her back.
Yeah, it's really kind of overwhelming at the moment, but I know that this is the right thing and I've just got to stay strong for her.
Right.
Okay, thank you so much. Thank you.
No worries.
Thank you very much. Bye, Annie. You'll be a good girl.
See you soon.
Thank you.
You ready for this? It's going to be a good thing for you. Yeah. You're going to be fine. How's that feeling, little one?
My whole mission here is to really make sure that Annika's quality of life is improved and set her up what should be a happy future ahead. But that future won't be happy unless she can walk well.
All right, let's get started.
Vet nurse Liesl is assisting Chris with a difficult operation.
The challenge at the moment is really working my way down through the skin, through the muscle layers, past the blood vessels to where I need to actually go through the leg. Just getting to a collection of nerves and blood vessels here. They're only small, but they can still bleed, so we're just going to clamp those off before we cut them. How's she doing?
She's been stable the whole way through.
Okay.
Once Chris is safely through the layers of muscle, he can begin delicately severing the nerves in the top of the leg.
Normally when you cut through nerves like I'm doing now, you get a twitching down the leg. But as I'm cutting through these, nothing's actually happening. So it is further confirmation that for whatever reason, the nerve function to the bottom part of this leg just is non-existent. Okay, Annika. There we go.
Finally, the deformed leg is removed.
It's actually come off reasonably well. I mean, we've managed to preserve all those blood vessels. Those nerves, we've cut through those with no major problems. So now comes the next challenge. That's sewing all together. There you go, one suture to go. Okay, we are done. We're looking pretty good. It's like there was no leg there at all. Annika's come through that operation remarkably well. When you consider how young she is and still how small she is, losing a significant part of your body like that, it is going to take its toll. From here, she just has to rest overnight, and tomorrow morning we'll start to see the future Annika, the new Annika, and hopefully the happy Annika. There you go. You through the hardest part. You just need to have a good sleep now. Yeah. Yes. Hello again. Look at you, huh?
At the Bondi clinic, it's been just one day since Chris removed little Annika's badly deformed front leg.
You bounced back, haven't you?
The 11-week-old rescue pup is recovering remarkably well and is already wreaking havoc.
This just says it all, doesn't it? This? Yeah? And this, right? Yeah, it's been quite the night. Annika recovered quite quickly to the point where she was licking her suture line and then decided to chew her own drip out, which is why she's now wearing the kind of shame.
Good girl.
Here we go. We get to see now, don't we? Yeah. Look in the eyes and say, why did you do it? Because you can get away with it, that's why you did it. All right, let's have a look at this wound. She's looking pretty good. We're not overly sore either, which is nice. I mean, it's going to be sensitive. So far, so good. I mean, she's bounced back remarkably well, and importantly, the area where we took the leg off looks healthy. All right, good progress. Although you and your tongue already knew that, didn't they? Every indication from Annika this morning is she's ready to go, but we need to see how this body performs. Annika, come here. Annika, come here. Come here, come here. Come here, come here. Oh, yes. Look at you go. This is the first time I've seen Annika run. Call her again.
Annika, come here. Come here, Papa. Come here, sweetie. Oh, you're so good.
You look at her face and it is full of delight. Suddenly, there's now so much to be excited about for Annika. And I know Rose is going to be desperate to see this. Are you ready for your moment? Yeah? Let's do it. Hey, Rose.
Yes.
Come out here.
Okay. Oh, baby. Oh, look at you. I missed you.
Look at this.
Wow, I know. I haven't seen that tail move for a while. Seeing her run, there's just no words. My heart's just bursting. I was expecting to see her, look like she was in some kind of pain, but true Annika form, she's fantastic. She's such a trooper.
So she's in pretty good shape.
Yeah.
And the wound looks good. It'll certainly flatten out and really improve.
Righto.
All right, well, there's only one thing left to do.
Thank you so much.
And over to you.
Okay.
All right. All the best.
Thank you so much.
You're very special to her.
Thank you. Thank you for everything.
No problem.
That's unreal. All right.
All right.
We'll keep you posted.
Please do.
Thank you.
I feel like I've got to know Annika so well, so quickly. And it's sad to see her go, but that sadness is really mixed with optimism because that personality of hers will go a long way with the right family. And I'm sure she'll find it.
Let's go find you a home, huh? Good girl. Let's go.
Doesn't hurt, does it, Belle, when I touch your tail? Eh? Does it?
Owner Kathy is growing increasingly concerned about her 2-year-old cat's broken tail.
Oh, your poor tail.
The nasty injury happened while Bella was being cared for by a family friend.
We were actually on a yacht off the coast of Corsica when it happened, and I got a call from Scott's practice to say that she had obviously suffered major trauma to her tail. I don't know, I was in shock really, because you don't really expect to be hearing that sort of news. It's been a bit sad to see her tail now just drooping down off the back of her body. She can move it a little bit. She does have a bit of control, but not very much.
I know, Bella. It's annoying, isn't it, that I'm standing by the door and you can't open it. What?
So, with no sign of improvement, it's meant Bella and her brother, Mr. Lucky, have been confined to barracks.
You think that can stop me? It's probably your curiosity that got you into this scrape with your tail, wasn't it, Bella? But we'll never know, will we? Okay, come on then, Belle. Come on then. In you go. Good girl. Right, there you go.
Now it's time to head off to see Scott to find out if Bella's tail can be saved.
Okay, Belle, make yourself comfortable because now we're off, okay? Big adventure, Belle. Come on then.
How do you feel things have been going?
She's been her usual demanding cat with attitude self, jumping all over the furniture.
At Richmond, it's time for Scott to decide the fate of Bella's fractured tail.
What kind of movement have you seen, if any?
Well, she does, the last 2 or 3 days, I have noticed she can lift it a bit, then it falls down.
We've still got a very floppy tail, haven't we? To actually dislocate a tail pulled two vertebrae apart, that would have really hurt and would have been done at quite some velocity. So generally it's a cat that's run, got caught in something, been run over, kept running, and the tail dislocates. What I'm going to do is just do a quick deep pain test.
Scott's checking the tail one final time for any signs that it can be saved.
I'm digging my fingernail in there and there's not the greatest of response there. It should be really quite painful, and the fact that she isn't would suggest that there's a level of nerve loss or nerve damage. This tail, being that it's not being positioned properly, can be caught indoors, can be caught on fences, can be caught up trees. If she has a good tug on that again, it can go from a significant injury to an absolute nightmare. I do think in this instance that it is probably the best option to consider amputating the tail.
So you poor little Belle. If we don't take it off, every time she goes out, I'll probably always be worried that something's going to happen to it and happen to her because she can't control it.
So that's exactly where we'll take it off from that point.
Right.
The risks of doing this procedure are that as there is a huge amount of nerves at the base of the tail there, you can damage their ability to do things like control anal tone. So it might be, in worst case scenario, that she becomes incontinent. That's the worst case scenario.
I think, we've just got to do it, really. Not doing it, to me, doesn't seem like a serious option. Yeah. So you poor little Belle. But you're going to be fine, aren't you, Belle? Because you're a tough girl, aren't you?
Tough cookie.
Yeah.
Sure.
Bella will now be admitted to the clinic. Her momentous surgery is scheduled for tomorrow.
It's funny, she's quite comfortable. Normally she doesn't like to be held, by someone who's decided to hold her. She doesn't mind if she's decided.
I know. You're being affectionate to the guy about to take your tail off. Not a great choice.
Well,
at least she obviously trusts me, which is nice, isn't it? Right?
Here she is.
Hello, Bella. You're being feisty. Hey.
There's a busy day ahead for Scott. Nurse Gina is bringing in his first patient, 2-year-old Bella.
Look at the eyes on it, hey? They're amazing.
The intrepid cat ran into trouble recently, breaking her tail.
Take that beautiful tail away, but it's just floating in the breeze now. It's just an accident waiting to happen, so definitely the right thing to do to remove it. Doing a surgery like this on a beautiful cat, it is heartbreaking. When you have to change their appearance forever, it is a real shame, but she will continue to be beautiful even when the tail's gone.
So brave.
But the cosmetic change in Bella is the least of Scott's concerns about the amputation.
This surgical case is a difficult one because the dislocation is just so high up Bella's tail that it's so close to a little bottom, and there's a huge amount of nerves around that area. And if you cut the wrong one, you can stop her feeling that back end area, and you can lead to lots of problems, incontinence being one of them, and that's the last thing we need with Bella. And bloody close to this poor little girl's bottom. All right, so we'll start now. I actually have to sever a part of the spinal cord, the bit that goes down into her tail. Obviously a nervous moment. You want to be damn sure that you're in the right position. I know the heartbreak of this type of injury and when it goes badly. I had a cat through university that had a tail pull injury, and sadly after 2 weeks he was unable to control his bladder and his bowels, and he did have to get put to sleep. So there's a huge amount of nerves, there's a huge amount of risk, and I've got a few nerves as well. There we go.
There we go. It's off.
Yeah, sorry, sweetie. Right, let's get this closed up now, shall we?
Scott's pleased with the surgery, but he won't know for a few hours yet whether Bella has sustained any nerve damage that will affect her bowel or bladder function.
Kathy tells me that Bella is quite the fighter. I feel that that tenacity is really going to help get her through and go on to live a happy life.
Beautiful. Even with the little tongue.
Hello, sweetheart. How are you feeling today? I know you're not happy about that collar, are you? I know.
At the Richmond Hill practice, Nurse Emma has her hands full with feisty tail amputee Bella.
Bella, now, that's not going to work, my friend. Can we leave the collar in place for 30 seconds?
The 2-year-old is recovering well from her big operation.
She's eating, she's drinking, her vitals are all within normal limits, everything that we'd expect.
I apologise, we took your tail, we're taking your dignity slightly. Good girl, good girl.
So everybody's been waiting for the evidence that Bella can toilet normally.
She's had a poo, which in the nursing world is thumbs up.
And that means Bella is free to go home with her relieved owner, Kathy.
Hey, Kathy, how you doing?
Scott.
You're right.
Yes, I'm fine. How are you?
Good, good. Yes, very well. And so's your girl. She's just through in the consult room, so follow me through.
Hi, Belle. It's been a big adventure, hasn't it, Belle? Okay.
So this is her new
my
look
goodness.
back end.
Oh my gosh, that looks great, doesn't it?
So you
It
can
doesn't
see
even look like she's had surgery. So I was really amazed, very pleasantly so, to see that it all looks so good. I mean, it looks like it was done, a couple of weeks ago.
But I still think her name applies, and that although she doesn't have a tail, she's still Bella. She's still beautiful.
She is, yeah.
And
But
I'm sure
she looks great.
I'm glad that you're happy with it because it's a strange looking back end.
But I mean, her fur will grow back, won't
The
it?
fur will grow back.
Yeah.
And certainly from this cat's point of view, she's a feisty little madam, aren't you?
She is.
And you're going to be absolutely fine, aren't you?
Yeah.
Yes, she is. Get me out of here before they take anything else off. I absolutely feel like we've all made the right decision. Not only does Bella seem more comfortable now the tail's gone, but it means that her future is secured and now she can go out and about and enjoy the great outdoors yet again.
We're all going to be happy. Thank you very much.
My pleasure. All right. And Kathy can be sitting resplendent on her couch, sipping a nice cup of tea without a worry in the world.
Come on, Bella. You can go out again. Yeah.
And 1 month later, a confident Bella is indeed back patrolling the neighbourhood.
Come on, Bella.
Without the hazard of her broken tail, she's now safe to roam as she pleases.
She's just loving it, and her confidence, hasn't taken a dent at all. There you go, back in one of your favourite places, aren't you? She's always been a small cat with a big attitude, and she's exactly the same. I've no regrets at all, and I think if any other cat owner was in a similar situation, I don't think they'd have to worry about it. It's just nice to see them going off and having adventures. But it's nice to see them coming back safely as well.
Hey, Belle. Hey.
Good morning.
Hi.
What's going on this morning?
So we've just had a cat called Merlin brought in. Looks like he's got a severe trauma to his left leg. He's also had a knock to the head.
In North Yorkshire in the UK, Louisa is starting work and is immediately facing an emergency.
He's fractured some teeth. He's had some methadone to make him comfortable.
So I've arrived this morning and they've told me that there's a lovely cat called Merlin who's been hit by a car. He's stable, but we believe that he might have sustained quite a nasty break to one of his legs. There's a lot of swelling around here.
As well as a suspected broken leg, Merlin has suffered severe trauma to his head.
He's got a fractured canine and a fracture to the back tooth.
Anxiously waiting for news of their beloved 2-year-old is owner Jason and his young daughter Lily.
You miss him. Your best friend, isn't he? He's a massive part of the family. We've got 2 dogs as well, and it just plays with them. It's like Tom and Jerry in the house. They just chase each other, lay with each other. The dogs are feeling it. They can tell he's not there, obviously. I just can't wait to get him back home.
Hello.
Yeah.
So I've got your little cat Merlin in, haven't I? Do you want to tell me what's happened to Merlin?
Got run over.
He did? Oh no.
It was my wife that found him. He was initially just lifeless laid there, and then obviously when she got closer, she seen the blood on him and the missing skin on his leg. Tried to talk to him, and he just wasn't responding.
Yeah. It looks like he's damaged that leg, doesn't he? Because he doesn't want to use that leg, and that leg is potentially broken. So what we'll need to do is take some x-rays and then we'll make a plan together. So I will show you the x-rays. Hopefully it's something that we can fix, but if not, we'll make a plan together, and we need to get him sorted, don't we? We want to get him home. Yeah? Are you missing him? Missing him? Yeah, I bet. Okay, cool. I'll go and do that and then we'll go from there, okay?
Thank you.
So this is the x-ray. You can see here quite a nasty fracture to the top of the humerus, and it's in such a horrible place. It's all really swollen and really painful. We're quite limited with our options in this position of the leg, which is why we had to have quite a frank conversation with the owner. So I'm feeling really sad. The fracture could actually be the tip of the iceberg. We could be dealing with lots of other injuries, in which case we've also got to think about the quality of life of that cat and consider whether Merlin, unfortunately, should be put to sleep, because some cats might not recover through the surgery. It's not looking very nice for him, so we've got to have some quite serious conversations with the owner about where we go from here, really. Do you want to come through? Do you want to see these x-rays?
Yeah.
In the north of England, Louisa is about to have a difficult conversation regarding the fate of Merlin. The 2-year-old cat suffered a severely broken leg when run over by a car.
Lily, this is an x-ray of Merlin. Now, can you see the difference here to here? The top of this bone here has completely broken off.
Merlin's owners, Jason and his daughter Lily, are worried the family's adored cat might have to be put down.
You love him very much, don't you?
You're worried about Merlin, weren't you?
As a cat owner, I do really empathise with them. You know, it's not their fault, accidents happen, and little Lily is definitely really worried. Do you want to listen to the heartbeat of Merlin? Okay, you hold that.
You hear his heartbeat?
Is he okay? Good. Lovely. So, I think best case scenario would be we amputate that leg. Okay. Cats recover remarkably well. Okay. I actually have a 3-legged cat. My 3-legged cat is called Oreo. I amputated her leg many years ago. I feel quite emotionally invested in this case with Merlin because I do have Oreo and she does have 3 legs. She came into my life very early on in my veterinary career over 10 years ago. She had a nasty fracture and I didn't want to put her to sleep. I wanted to save her, so I amputated her leg with the intention then of actually rehoming her, but she never left. So she's still doing exceptionally well with the 3 legs. It's not stopped her doing a thing. What I can do, Lily, I could show you videos of my 3-legged cat and how well she does. Would you like to see that?
That'd be good, wouldn't it?
Would you like to see them now?
Be good, wouldn't it? She looks really comfy, doesn't she?
Yeah, she does. And she's so happy. She's not had a front leg for almost 10 years now.
Merlin does that, doesn't he?
Does he?
When he's content, rolls over on his back.
Reassured by Louisa's personal and professional experience,
I promise you, he's going to be so happy and you won't even notice.
Lily and her dad agree to removing Merlin's damaged leg.
Goodbye, little fella. See you in a bit. Thank you.
No worries. I'll look after him for you.
Cheers.
Okay. See you soon.
Thanks.
Good boy. This is a bit of a difficult surgery and I do feel a bit nervous.
In North Yorkshire, Louisa is about to start amputating the shattered front leg of car accident victim Merlin.
This is just a sterile bandage, which means that we can move the leg freely during the surgery. This is the one that will be coming off today.
Louisa has called on her colleague Emma to provide an extra pair of hands for the challenging and risky procedure.
I've got my lovely colleague and friend Emma. She's one of our other senior vets, and Emma and I are going to have a lovely Smooth sailing surgery. We're going to get Merlin fixed and off the table in no time. So I'm going to start. The procedure itself is quite tricky because there's lots of muscles and there's lots of nerves and blood vessels, and you've got to find them and take them off in a specific way, so it's not straightforward at all. We will be taking off the whole limb, including the shoulder blade. Oh my goodness, it's very awkward. The thing is, it's all very swollen, this leg as well, which can make sometimes finding your landmarks a bit more tricky. So, this is the hardest bit really, it's just kind of getting your bearings. But I think it's this muscle.
More sense, though.
Yeah, so it's this muscle here that's got to come off. That's got to go as well.
Having to cut through all these muscles, it just doesn't feel natural. We just have to keep reminding ourselves that it'll make much better quality of life.
If you put your fingers under there, look, so it's got to be under there, yeah, because that's the brachial plexus under there. Yeah, doing great, doing a good job.
But as Louisa dissects the muscles connecting Merlin's damaged leg to his body,
Just dropping a little bit.
Sorry.
suddenly the 2-year-old's condition deteriorates.
Blood pressure's dropped again.
Right, so can you do a little bit of a fluid bolus, please?
Okay.
We're going to make sure that we save his life. We are noticing changes to blood pressure, we are dropping temperatures, but we had things in line to sort of try and mitigate that.
Blood pressure's back to normal.
The 2-year-old's vital signs are now back within a safe range.
So yeah, he's really settled, his temperature's come up nicely, blood pressure's normal.
Be really careful in this bit. We're just getting to the slightly scary part. In the armpit, there's a bundle of arteries, veins and nerves. And so we're going to try and find them. So we're going to put local anaesthetic in the nerves, because unfortunately we obviously have to cut them. And then we'll find the blood vessels, tie them off, and then it's just a case of careful dissection to try and get the rest of the leg off without causing any further trauma to this poor little man. It's like a very busy road map. I'm getting quite stressed when I'm in there because there's lots of stuff going on. So there's lots of nerves and lots of, you know, these important blood vessels that if you don't find and tie them off, you're going to have quite a big hemorrhage. Sorry, mate.
Tensions are high as Louisa and Emma work through the most critical part of the operation.
It's trying to like...
I know. Sorry. The muscle, it makes me jump. So it's
I stabbed you then.
No.
Can't be blocking your fingers.
It's fine. So it's totally normal to have muscle twitching. The Merlin can't feel it, but it means that you know you're in the right place. So we're blocking the nerves that go to the muscle.
What sharp fingers.
Finally, after a few scary moments,
Okay, and there he is. So relieved that the leg's off, but really sad as well because it's just, I don't know. It's just really sad to know that you've removed a leg, but you know that it's the right thing. Goes against your values, cutting things off when you actually want to put them back together. So now my job is to put him back together and have a lovely, nice wound for him to go home with. Right, sweetheart, your new life begins. Okay, that's us done. I'm really pleased with the way it looks now. It's nice and cushioned, so when he ultimately lies on it, it won't feel uncomfortable because we've removed the shoulder blade, and sometimes if you leave the shoulder blade in, it can be quite bony and a bit uncomfortable. So yeah, I'm pleased, and now he's just got to recover. Right, sweetheart. Good boy. Hello. Oh, good boy.
in North Yorkshire, Louisa is checking Merlin to see if he's recovered enough to go home after his badly damaged leg had to be amputated.
He's doing really well. He's just recovering nice and slowly. He's got some strong painkillers.
Are you looking forward to seeing him, picking him up and getting him home? Yeah, me too.
Jason and his daughter Lily can't wait to see the family cat they love so much.
Constantly thinking about Merlin and shall I ring up? Are they going to ring me? Hope the operation's gone well. Really excited to see him.
Let's go and get your mum and dad.
son.
Feeling a little bit snoozy, okay, he's a little bit tired. He's going to have some pain relief, but otherwise I think he just needs some quiet time, yeah. He's so brave, isn't he? He's so brave.
Yeah, there's one in the cage.
Brilliant. Yeah, that's where his leg was. You okay? So that's his scar and that's his scar. So he's so brave, isn't he?
He looks really strange, doesn't he?
Are you okay? He's so brave. He's gonna have. He's so clever. It's just so nice to get them back together. He's such a lovely cat with a lovely family, and I'm really confident that he's going to make a nice recovery in no time.
I'm relieved to have him back and alive, I'll be honest.
He's been gorgeous. He's been an absolute trooper. Do you want to help me put that in? Well done.
With Merlin's owners keen to take the 2-year-old cat home, Louisa has instructed the owners on how to keep him comfortable overnight.
Shall I see you soon? Yeah?
I'll go on you.
Right.
High five.
Yeah. Your job's to look after. You
Thank
take
you
care
very much
anyway.
for all your
All
help.
right.
Yeah, much appreciated.
Thank you so much. See you later.
Thank you.
Look after him for me. Do you want to cuddle?
Yeah, of course you do.
That was nice. Thank you. See you. Bye.
Thanks, Louisa.
See you
Cheers.
later. Bye.
Bye. You excited?
Hello. Hi.
It's been a week since Merlin had his shattered front leg amputated.
Oh, that's healed so nice.
Owner Jason has brought the brave 2-year-old for a post-surgery checkup with Louisa.
So he's adapting really well at home.
Everything you would expect, yeah. I'm quite surprised how quick he's up on his feet.
Is he still wanting to jump up and off things?
He jumps on the sofa, yeah. I got a shock second day home. I opened the cage door and he jumped out, a bit like a rabbit. He's been remarkably well, so he's definitely back to his normal self.
How did little Lily take to having him at home?
Oh, she's loved
Oh,
him. She just wants to cuddle him.
Of
Obviously,
course,
when
yeah.
he's in the cage, he
Yeah.
just wants to get in with him.
What a treasure. The wound itself is looking absolutely gorgeous. There's no swelling, there's no infection. It's looking really nice. Should I pop you on the floor to have a look at how you walk? To have a explore? Merlin is very, very chilled. He's recovered really well so far and he's dealing with 3 legs so well. He's just got no pain whatsoever. Oh, I'm so pleased for you and for him. There's no reason why he can't live to a ripe old age having 3 legs, being a normal cat and even being a normal outdoor cat if that makes him happy.
Yeah.
Oh, sweetheart.
Right, come on.
In Atlanta, Georgia, Juliet and her son Jordan have arrived to see Arvid with an unusual pet.
Hi, how are you? This is Bedrock. This is Bedrock. I got Bedrock when he was about the size of my palm, and he was 2 months old, and now he's 7.
Bedrock is an African spurred tortoise.
Bedrock is a really fun tortoise. He has a lot of energy. He's very spontaneous, and he likes to go running around, and he's an escape artist, likes to explore.
All right, so the moment of truth is here. I know you've kind of given me a little brief background over the phone, but this is my first time seeing Bedrock, right?
She's actually got this really hurt arm, if I'll pull her out.
Okay.
Let's turn her around.
She's very attractive.
Yeah, she's got a beautiful show.
So tell me more about the injury. What happened?
She unfortunately got it caught in some mosquito mesh outside of my gazebo, and it got wound up really, really tight. It was about 16 hours before I caught it, and she actually did really fine for a long time. And this is over a year ago the injury happened, and just in the last 2 or 3 months, she's been declining.
And when you say declining, she's like not walking on it anymore?
She'll walk on it for food, but she
Okay.
really doesn't want to put the weight on it. It seems to bother her, and her foot just seems to have disappeared.
And since then, it's just kind of been going downhill.
Well, she did fine for a very long time, and she had a little bit of a limp, and it was maybe a little discomfort, but not something you would see every day. It would be like on an occasion.
Yeah, you can definitely tell that this tissue here is looking devitalized there, and see any way to salvage it. I'll tell you what I'm gonna do. We get some x-rays, we'll get some blood work on her, and try to see if this is something we can kind of rehabilitate and maybe bring back. If not, then we may be looking at potential amputation.
Right.
so that she could have a good quality of life, because definitely this leg doesn't look good at all. Amputating the leg is obviously the last resort, you know, and so.
Or even maybe removing a part of it, if it needs the whole thing taken off.
Typically with these guys, because if you leave a stump and they're able,
it can
continue to get irritated. So usually if we're going to amputate, we're going to amputate pretty high up.
Right.
And then we'll have to maybe put a prosthesis on the bottom of the shell here to kind of, you know, elevate it.
Yes.
But if we have to amputate, you know, I will definitely let you know. And of course, the anesthesia in these guys are very tricky, but that's one thing that we take very seriously.
Yes.
It's very monitoring them very closely.
Right.
Yeah.
I just want the best for her. She's great.
She's gonna do fine.
I've had her through thick and thin.
So I am really worried about Bedrock's leg, because it doesn't look like there's any blood supply going to that leg. It looks like it's been cut off and the leg is actually rotting. You can see the skin sloughing, and she's definitely in pain. So I'm really worried that we may not be able to save this leg. I'm hoping we can, but realistically, it's not looking good.
Oh, you're beautiful. Oh, baby.
She's real strong.
Holy moly. Okay.
You're doing great.
Ready? 1, 2, 3, poke.
In Atlanta, Georgia, Arvid and his team are facing challenging amputation surgery on 7-year-old Tortoise Bedrock.
It's gonna make you feel better, I promise. That's some really, really good pain control.
The thing with these guys, it's tough to do much without anesthesia. And if you get your hand caught between the leg and the shell and they draw that leg back, they can really break your finger and do some damage. These guys are super strong. So we're gonna give them a little sedative to relax them so we can get the x-rays, get the total picture, get the ball rolling with getting Bedrock back to good health.
Yeah, let's put her all the way side, lateral.
Here's the problem. Definitely there's some lucency changes in the bone. Almost looks like it's like a moth-eaten appearance. Yes, you can see that with cancer, but in this case, I just think it's infection that's gotten into the bone. And you can see the digits look like they're kind of eaten away. So if you look here compared to the normal leg, which is here, you can definitely see the difference. You can see all the digits coming up here, but then on this leg, they all look like they're cut off, and the digits, all that looks like it's been eaten away, and there's some infection and inflammation in that bone. She's not gonna get that back. So unfortunately, it looks like the next step is to amputate. You know, it sounds kind of brutal, but in the end, she's gonna be happier, healthier, pain-free. Hello, Juliet. It's Dr. Edward.
Hi, how are you?
Hey, so we took the radiographs of Bedrock, and unfortunately, in her leg, and especially in her bones, there definitely looks like there's some inflammation and infection that's kind of eating away at the bone. You can definitely see some bone loss and some areas where it looks like there's some moth-eaten appearances. So, unfortunately, you know, it looks like we're gonna have to amputate.
Right. Are you gonna take the whole leg?
Yes, we're gonna take the whole leg.
I know she's safe in your hands.
Yes, we're gonna take good care of her.
All right, thank you so much. Thanks for letting me know.
You're very welcome.
So you just go up and like this.
Mm-hmm. So now we're about to place the endotracheal tube so that we can get her induced for anesthesia. So the thing about these guys is that they have a really short trachea. So the tracheal bifurcation is very high as opposed to a dog or a cat. So when you're tubing these guys, you gotta be very careful not to go too far down, or you can only oxygenate one side of the lungs, and that's not good. So I created a little plastic gadget, if you will, to prevent that. We can just keep the eyes where we can move them. She's doing really well. And we have our Doppler hooked up so we can hear her heart rates, which is very important. Because it's not like I can put my stethoscope on there, so. I'm concerned, but I'm optimistic. Bedrock seems to be in good health, very strong girl. However, reptiles with anesthesia is very dicey. It makes you nervous. I'm not gonna lie, I'm nervous, but we gotta do what we gotta do. Okay, I'm cutting.
Okay.
So my goal is to get Bedrock home. I know how much she's loved by her family, so that's what I'm gonna do. Trying to do this surgery around the shell is just tough. So I'm trying to navigate with this shell in the way.
Any recoil?
She flinched. I don't know if I hit a nerve or... So because she's still flinching, when I hit certain spots, that tells me she's still feeling it. So we're gonna have to give her a little more sedation to try to get her down to where she's not feeling this at all. So just still dissecting away here, trying to get down to the joint so that I can disarticulate this leg at the joint. It's just a very tight pocket, so it just makes it harder. So the problem is she's still twitching. So we're trying to get her to where she's supposed to be anesthetically.
Arvid now has to administer even more sedative to ensure Bedrock is not aware of the intrusive surgery.
This right here is why I don't do reptiles often. Okay, go ahead and lift up the leg. Yeah. I'm having a tough time finding joint space. So what I've decided to do is to saw the bone off cranially as I can, and I think that'll do the trick.
Okay, leg is off.
Then we can go ahead and start to close. So over the next few days, it's going to be very critical as to how Bedrock does from this surgery. We waited for her to go down with anesthesia. Now we got to wait for her to wake up. And in tortoises, that can take a long time. So our work is not done. So with tortoises, they're slow to go fully down on anesthesia, but then waking up takes them just as long, if it's not longer. So we're in for a long wait. So now we're about to do the prosthesis so that we can give some elevation to that area now that she doesn't have a limb, to help with her mobility, prevent damage to the shell, and help prevent injury and pain. So the arm will come here, so I'm thinking like right
like
there.
here-ish.
Because when I've seen the wheels, they've all been like
here.
right there.
Okay.
Set time of 15 to 25 minutes. So I'll put a prosthesis on her, something that I made up with like a tennis ball. So I just hope she's able to keep it on for, a good amount of time.
Oh, good morning. Good morning, sunshine.
So she's starting to recoil her head now. She has retracted it back into the shell, which means she's starting to come to.
So she's finally giving us some reflexes here. As you can see, she's pulling in those feet right when we pull them out. She's giving us some resistance here.
Bedrock's owner, Juliet, is keen to be reunited with her special girl.
I'm excited to reunite Bedrock with her owner because I'm pretty sure her owner has been sitting on pins and needles all day, and she's gonna be extremely happy to see Bedrock, and not just see her, but very happy that she made it through the anesthesia. I know that was a big concern of mom's.
Hi, my girl.
Maybe she hear your voice, that might wake her up.
Hi, girl. Oh, my baby.
Just got a little prosthesis and see how it kind of elevates that shell.
Yes, do you think it'll have issue against concrete?
No, because this slides.
It slides, great.
This slides.
Absolutely.
Yep.
This looks fantastic. Very ingenuitive. All right, thank you so much.
You're very welcome. Absolutely.
I'm very grateful. I know
Good.
she is as well.
Yes.
I'm definitely very relieved that Bedrock is okay, and I'm just really grateful the surgery went well.
All right, you have a good one. All right?
All right, great.
All right.
Bedrock the tortoise has made a remarkable recovery from amputation surgery. After losing her badly damaged leg and being fitted with a prosthesis, the 7-year-old is coping well, taking life one slow step at a time.
Where are you going? He wants to go explore, man.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.